Ladies and gentlemen, welcome to day 2 of the cardiovascular system. We have a lot of material to cover today. This is the first set of images that you should have printed off yesterday. We're picking up on page 283 of the textbook, that section of reading that you were to do from day 1, page 283 through 287. We're going to discuss that up to and including the great vessels of the heart today. So, if you guys get your images out, that would be great. So to start with, page 283, the function, location, and size of the heart. So the heart is a hollow muscular organ. That goes without saying. It is the primary muscle or the primary organ of our cardiovascular system. It's divided into left and right sides. So essentially, we have two pumps with 4 chambers in those 2 pumps, two chambers in each pump. The average heart pumps about 72 times a minute, and this changes with age, cardiovascular fitness level, and sex. The females oftentimes will have a higher heart rate than males. Cardiovascular fitness, very fit people will oftentimes have a slower heart rate. I had a student in Plum whose resting heart rate was somewhere between 45 and 55, just sitting there watching us on the video conference screen. And I had a girl in Bonneville whose heart rate would change between 100 and 120, just sitting there at rest. So people are different. Your heart will beat in excess of 3 billion times throughout your life, and honestly, it's one of the most most important organ in your body. It keeps everything else alive. When it stops, everything else does as well. So if you close your fist in front of your face right now, you would close it up and you make a fist, that's about the size of your heart. A lot of the other components of the heart that make up the bulk of the top end of it are the vessels coming in, the great vessels, the aorta, the superior and inferior vena cava, and the pulmonary veins and arteries as well. The base is the flat part that's actually on the top of the heart. When they refer to base in medical terminology, the base of the heart is located right up here. It's the flat part. Up here is where we also have the great vessels, like I said. Now the apex refers to pointy part, not top, refers to pointy part. So the apex of the heart is down here. It points off to kind of the left side. It's located at both the second level, or probably the level of the second rib. Okay. If we look at our lungs, the base is here and the apex is the top pointy part. So when we refer to, when we use medical terminology, we have to know the exact content, because when I talk about base, a lot of people think, well, that's the bottom. Well, it's not. It's the flat portion of that organ. Now, the precordium refers to the area on the anterior chest wall just overlying the heart and great vessels. So the precordium is this area here over top of the chest. It just overlies that heart. Now, people say that the heart is located on the left side. Well, it's typically midline to left side in a space called the mediastinum. The mediastinum is an organ space between the left and right lung that contains the trachea, the esophagus, as well as the heart. The heart's layers and coverings. If we look at the layers of the heart, the first outer layer that we really don't have a diagram for here, the outermost layer is called the pericardium. Actually, I'm going to start on the inside. The endocardium, as it says in the textbook here, it goes in that list here. The endocardium, the prefix endo, E-N-D-O, endo means innermost. Okay, the endocardium is the innermost layer. It's very smooth and very shiny. It extends out into the valves and is continuous with the blood vessels, and it enters and leaves the heart. The smooth, shiny surface really disallows any turbulence. We want blood flow very smooth through the heart. Turbulence creates actually, some turbulence in the blood will actually cause platelets to spontaneously stick together and create clots. So we want a nice smooth flow through the heart, and this smooth little endocardial tissue is what facilitates that. The middle layer, or myocardium, M for middle, M for myo. Myocardium is the middle layer of the heart, and it's the thickest of the 3 layers, and it's the actual muscle that does the work. Okay, you can think of the endocardium and the epicardium and the 2 surrounding areas, layers that help protect and cover the outside of the myocardium. The myocardium is actually the muscle tissue that contracts. It's what undergoes the contraction. The actin. It contains the actin and myosin myofibrils that contract it. that form the cross bridges and so on. And if you've gotten into Bio 30, you'll understand what I'm talking about. But suffice it to say that the myocardium is the muscle layer. The epicardium, the outermost layer of the heart, it contains the myocardium. It also extends out to form what's called the pericardium. The pericardium is a sling-like structure that forms part of the epicardium, and it helps to suspend the heart in the chest cavity. There's a little diagram on the bottom of page 283 that shows almost like a handkerchief that the heart is laying in, and that is the pericardium. Now there is a space, just a little tiny space between the pericardium and the epicardium, or the other parts of the heart there, the heart itself. And this area contains what's called serous fluid. That serous fluid resembles egg white, and that's what it's named after, the serous fluid, 10 to 30 milliliters. And this egg white-like material, it makes that area very, very slippery. It lubricates and protects the heart from being irritated as it rubs against the sling-like structure, the pericardium, that suspends it within the chest cavity. You can appreciate the heart cannot stop to repair itself. So we've developed this ability, or this characteristic of the serous fluid that lubricates and disallows any friction or any irritating force to develop on the on the heart muscle itself. Now, at times, this tissue can become inflamed because of a blow to the heart, or because of a disease state, an infection, and so on. And this pericarditis, or inflammation, the suffix itis refers to inflammation, can cause a pain, or what's called a pericardial rub. When cardiologists listen to the heart, they can actually hear the heart rubbing on the pericardium, because the serous fluid is infected, or it's deteriorated, or the patient has had an issue therein, and the pericardium is actually rubbing on the heart, which causes inflammation. This pericardium can also contain fluid if the heart is injured, if the heart tears, or if there's say a knife wound or a stab wound. If the heart or the great vessels within that pericardial cavity are bleeding into that pericardial space, the blood can actually accumulate within that pericardial space and cause what's called a pericardial tamponade. If you can imagine, every time the heart beats, it would squeeze out a little more blood into that pericardial space. Eventually, the blood in that pericardial space would begin to exert a pressure back on the heart, squeezing it. So the heart would no longer be able to expand to accept the return blood flow, and cardiac blood flow would be impaired. This is a life-threatening situation that results in death. A shock and death if it's not rectified early on. So a pericardial tamponade. So if we flip over to page 284, 285 now, the circulatory system is basically divided into double pump and two circulations. The right side to start with here, marked in blue, and blue is signifying the deoxygenated blood circulation. We have the right side of the heart, and we have the right side of the heart circulates blood out of the heart into what's called the pulmonary circulation. So the pulmonary circulation is that circulation going out to the lungs with deoxygenated blood, getting smaller and smaller into the pulmonary capillaries, where it comes into close contact with the alveoli, as we learned about in the previous course, the respiratory system. Out in the alveoli, the diffusion pressure of high concentration of oxygen within the air in the lungs moves oxygen across the semipermeable membranes of the alveoli and the capillaries onto the hemoglobin within the blood, and vice versa, carbon dioxide to a certain degree out into the respiratory air and exhaled to get rid of some of that carbon dioxide, a small percentage. The rest of it is used for other balancing and so on. We talk about that in the respiratory system. That reoxygenated blood is then circulated back to the left side of the heart, and that left side of the heart pumps that blood out to what's called the systemic circulation. The systemic circulation consists of arteries, arterioles, and capillaries that deliver oxygen and nutrients to the cells of our body, gather up the waste products and deoxygenated blood, carbon dioxide, and put it back to the right side of the heart again for recirculation through the pulmonary circulation. So, right side takes care of pumping blood out to the pulmonary circulation. Left side takes care of pumping blood out to the systemic circulation. Make sure and keep those two straight. Now, when we look at the heart itself, we have a number of vessels and great chambers and vessels vessels, great vessels and chambers. I'll get that crap straight here that we need to understand. I always start on the right side here. Okay, so we have coming in from the bottom here. First of all, the inferior vena cava. So vena cava refers to the lower vein here. Okay, inferior vena cava coming from the inferior aspect of the body, the lower part. And we have the superior vena cava coming from the superior aspect of the body. Essentially, if you put your arms out to the side, everything from your armpits up come down through. This is superior vena cava, armpits down from the inferior vena cava. When it gets from the inferior vena cava, it enters the right atrium. The right atrium is the first chamber on the right side of the heart. Then it goes through what's called the tricuspid valve. This is a cuspid valve. Okay, this is a cuspid valve here. Essentially, it has three little flaps that are held pointing inward by what are called chordae tendineae. These little cords here pull these little fingers of flaps into the right ventricle, which is the lower compartment, and the ventricle is what actually does the work. Okay, as that blood passes through the tricuspid valve between the right atrium and ventricle, okay, as the blood fills up this ventricle here, it causes to stretch. Then it exits into the pulmonary circulation through the pulmonary semilunar valve. This pulmonary semilunar valve here is also called the pulmonic valve. Okay, it exits there and splits into right and left, or this is the left side and this is the right side because we always refer to the patient's right and left side. Right and left pulmonary artery. Now, arteries flow away from the heart, veins flow towards the heart. These are the only two arteries in the body that carry deoxygenated blood. Okay, that'll be a trivia question you'll get right on some game sometime. So the right and left pulmonary arteries carry blood out to the pulmonic circulation. If we flip back up here, it's the right and left pulmonary arteries carry out to the pulmonary circulation, where the pulmonary arterioles and then pulmonary capillaries allow the blood to pick up oxygen and drop off carbon dioxide and waste products in the lungs. Then it's gathered up through the pulmonary veins. And these veins gather up from the right side and the left side, gather together into the left atrium right here. Now, interestingly enough, again, these are the only veins in the body that carry oxygen-rich blood. Most other veins, going back to the heart, carry oxygen poor. These two enter the left atrium, and that left atrium empties its contents into the left ventricle through what's called the bicuspid valve. It's a cuspid valve just like the right side, two little flappy doodles, but it only has two flaps instead of three. It also has the chordae tendineae that holds the flaps pointing inwards. As that blood enters the left ventricle, you can also look at the muscle of the left ventricle here. This isn't a typo. The left ventricle is much more muscular than the right. If you think about it, the right only has to push blood out to the lungs, which sit on left and right side of the heart. The left ventricle has to push blood out to the systemic circulation, which is all the way down to the tips of your toes and your fingers, your earlobes, and it has a long distance to push that blood. It pushes that blood out the aorta, which is through the aortic semilunar valve right here. That aortic semilunar valve opens, allows blood to flow out through the aorta. Now, if you hold your thumb up in front of you, your thumb is about the size of the aorta. Okay, that gives you an idea how big that pipe is. So as it pumps, blood comes out the aorta, and then out all these other subclavian arteries and carotid arteries and so on. Immediately after it exits the left ventricle, blood is ported off to different parts of the body, and it feeds to the systemic circulation. That aorta, this goes through the aortic arch and drops down behind the heart, and you can see the aorta descends down through the midline of the body, actually adjacent to the spinal column, and continuously feeding off different arteries left and right side, feeding our liver, our kidneys, our everything, even the tissue of the lungs and so on, and it feeds all of our cells right down to the ones at the tip of your toes and tip of your fingers and so on. So that was the major content for today. So going through it very quickly again: inferior vena cava, superior vena cava emptying into the right atrium, which passes through the tricuspid valve into the right ventricle. Right ventricle exits out through the pulmonic valve or pulmonary semilunar valve into the right and left pulmonary arteries. Right and left pulmonary arteries go out to the lungs for oxygen. Right and left pulmonary veins bring back the blood from the lungs into the left atrium. Left atrium empties through the bicuspid valve into the left ventricle. Left ventricle squeezes blood out the pulmonic semilunar valve into the aorta, and the aortic arch descends downward to the pulmonary, or pardon me, to the systemic circulation, and then it all goes back around and around and around. Okay. That is it for the content for today, ladies and gentlemen. What I'd like you to have a look at now is your assignment in the old study guide that I've scanned and put on there. I'd like you to have a look at page 172 to 173, questions 1 to 26. Have a look at them. Then have a look at page 288 through 293. Essentially, we're going to review the heart valves, blood supply, and pathway through the heart. And if you paid attention to today's discussion and so on, it's not going to be a whole lot different. I always start in the same spot with the inferior superior vena cava on the exams and stuff as well, so it's easy to remember. So page 288 through to 293, and we will talk to you all tomorrow.